Ooh, getting a little bit of feedback there. So if you can mute your phone if or your computer. Thank you. Hey, Antoinese, good to see you.
How you doing?
All righty. We'll get started in just a few minutes. Folks are trying to chime in here. Hey, Pam, I see you're there. How are you?
I'm fine. How are you?
All righty. Hanging in there, hanging in there.
Yes, doing the best we can.
That's it, one day at a time.
Yes.
And we'll try and keep track of who all is here. And we got folks calling in too. So at the end, we may just do a quick roll call just to make sure that we've recorded everybody's attendance. Hey, Miss Addie, how are you? We'll get started in just a few minutes.
I'm good. How are you doing?
Good. That way we can have a record of it for posterity of who was in attendance today, like we do at the navigation meetings. Just all of us adjusting and doing it a little bit different. Got about 3 minutes if anyone wants to run grab them a water or something before we get started. Unfortunately, I have no popcorn to share today, but I was thinking about that earlier. We don't have our popcorn at our navigation meeting. Hey, Mr. Morgan, good to see you. We'll get started in just about 2 minutes.
Sounds good.
All right, I'm gonna go ahead and Yep. Give me just a second. Let me pull up what I was looking for. Pull up the presentation for today, and let's see how we can do this. All right, let's see if I can do this efficiently. There we go. Again, we'll get started in just a few. Give it another 2 minutes, and then we'll get started. While I'm in the sharing mode, I cannot see the attendees. So Tammy or Terry, if you'll be checking them off on a list. And again, at the end, we'll do a quick roll call just to make sure we've accounted for everyone's attendance.
Yeah, I've got everybody except the call-in users.
Okay, so do you want to, real quick, let's call in users. I know Miss Edith was one. Who else is on the phone? Tammy, okay.
And I don't know who the other one is.
Melvin,
I got you, Melvin.
I called in as well.
Oh, you just want to be here twice. You don't get extra credit. All right, we'll give it another minute and then we'll get started.
Oh, now who's caller 6?
All right, we got about 30 seconds and we're going to get started. We'll mute the phone for just a little bit, and then we'll remembering it during the presentation, if anybody wants to ask any questions or anything else, just unmute at that time. But if we can unmute, Tiffany is apparently having trouble hearing. Hey, Miss Devlon. Not quite sure why Tiffany's having trouble hearing things. Melvin said just try calling in as well. Okay, well, thank you guys, because I can't see the comments to respond to them until they've already gone. So let's go ahead and get started. Good afternoon. Happy Tuesday. In fact, I was thinking earlier today it was Wednesday. I guess that was wishful thinking. Gonna obviously do this meeting just a little bit different, but you know, we want to make sure that everybody has a chance to see what's going on, learn what's going on, share our ideas, our concerns, and how we can come together and make some things happen. Got a couple things to discuss today, so we're going to get right into it. And it's not moved. There we go. All right. First thing, Miss Addie Britt is going to talk to us. She's from Columbus Consolidated Government. We're going to talk a little bit about the U.S. Census and our hard-to-reach populations, and then we'll go into some other things. Our updates on the COVID-19 in a new intake tool that's in HMIS after 4:30 today. Some agency updates, wrap it up, announcements, some posters, and some resource links, and of course have discussion along the way about anything anybody needs to discuss or wants to talk about. So Addie, we're going to take it off to you. I will forward your slides whenever you tell me to.
Thanks, Pat. And, you know, whenever you have time to, go ahead and forward them. So everyone, my name is Addie. I'm with the Columbus Consolidated Government. Normally, I'm just a transportation planner, but in the midst of the 2020 census, I've become one of the points of contacts for our outreach for the city and our region. And I really just want to touch base with our continuum of care organization, in particular with the service-based enumeration process that was supposed to take place March 30th through April 1st, but has now been postponed until April 29th through May 1st. And I just want to get a little feedback, or get a lot of feedback from you all, so that the city can know how best to, you know, support you all with those counts, and, you know, if there's any additional preparations that need to be had, especially with the coronavirus pandemic, because I know that your organizations are already, you know, stressed and strapped as it is with dealing with that. But if there's any resources or ideas that we need to come up with in order to ensure that we're counting everyone, particularly individuals who are homeless or underhoused, we, you know, just want to hear from you all and see how we can best do that.
Can we go ahead?
Yeah, go for it. So it's going to be real quick. I just want to ask a couple questions to see, again, to get hear back from you all. So I guess the first one is, has anyone heard from the Census Bureau recently about the postponement of the 2020 service-based enumeration process? And are you all familiar with it and how that goes and things like
that? Addie, I'll start off because and give everybody a chance to unmute it as they want to talk. But no one had contacted our office or anyone that I talked to about doing a service-based enumeration. Now, I'd really like to hear if others had heard anything or whatever. Anyone out there heard anything from the Census Bureau?
Okay.
So Lindsay's commenting that she hasn't heard anything about it. Yeah.
Yeah, we haven't heard anything about it at all.
Okay. Sorry, I'm also just taking notes so I can.
So,
okay, so sorry.
Yeah.
And I think my next.
So somebody's saying that.
Oh, I see that.
I'm sorry. Go ahead.
No, I'm sorry.
Yeah.
I just saw that comment too. Thank you, Melinda. Okay. Melinda, what organization are you from?
She's from Valley Interfaith Promise.
Oh, okay. Okay. Did they like give you any information about what they were planning on doing and like as far as or working with your organization to get the complete count, or was it just like a hey, this is happening?
You hear that?
Okay. Thank you, Tiffany.
Yeah, thank
And Tiffany, what organization are you from in Sandy as well? I'm sorry, I'm still learning everyone. House of Time. Okay. Thank you, Tiffany.
And to answer your question, Melinda said it was a hey, this is happening kind of thing.
Okay. 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 All right. That's kind of what I was expecting. I haven't heard a lot on our end either about the service-based enumeration, particularly with COVID-19, and how that's going to change how they're planning on taking that count. And again, so what was about this? And again, this is one of my first census operations as well. So I'm trying to figure out exactly how each organization, what their role is and how that ends up working out. Can we go to the next slide?
Sure.
Thank
Did someone have something to say? There. Wait, I may have hit it too many times. Is that good?
you. No, that's
Is
good.
that where you were? Okay, cool.
So in this slide, I just want to give everyone the updated version of the 2020 census operational adjustments that are due to COVID-19. So the schedule has changed. So I have a reference before for service-based enumeration, which would impact our COC and a lot of our other service-based institutions that focus on low-income or homeless individuals. Originally, that was scheduled for March 30th through April 1st, but it's been delayed for April 29th through May 1st. And that first link on that slide, oh, okay, thanks, Tiffany. Appreciate that. That first link on that slide, that's another link to get to that PDF if you want it or want to share it. And the other two are just other articles that I've seen, just kind of talking about how different cities are adjusting due to COVID-19 for their service-based enumeration. So again, just in case anyone was interested in learning more what other places are doing. But that's really kind of why, again, I want to speak with you all and get a feel about what's going on or who's contacting you all, because it seems like a lot of cities were expecting the Census Bureau to be doing a lot more as far as coordinating the service-based enumeration, but we're starting to learn that, particularly with COVID-19, we might be left to fend for ourselves as far as really making sure that we're able to get a complete and accurate count. Can we move to the next slide, please?
Sure.
Thanks.
I promise I'm trying.
It's okay.
Believe it or not, we did rehearse this.
No, I mean, technology has a mind of its own, so.
Okay.
Ooh. Let's see. Okay, there we go.
Oh, sorry. Now it goes back too far. There we go. Okay.
No, it's perfect. No, I mean, all these are going to bleed into each other anyway. So has anyone participated in the previous Census Bureau service-based enumeration process? And if so, what was your experience?
So 10 years ago, anybody have any experience with the Census Bureau and doing the census at your facilities or locations or whatever? I hear nobody. Okay.
Yeah. Okay. So this is good information. And if I haven't explained anything thoroughly, I guess I should have started off explaining exactly what is being enumerated and why the Census Bureau is coming into our region to count people. So if you haven't heard, 2020 census is upon us. April 1st was the official census day. Again, I apologize for just jumping in. But okay, thank you, Liz. And I'm assuming this is Liz Dillon?
Yeah.
Maybe? Okay, thanks, Liz. Okay. But yeah, so again, sorry if I jumped in and just kind of started going. This has been my life for the past like year or so, so I'm just so used to everyone else, expecting everyone else to understand what I'm talking when I just immediately go into it. So just one organization had experience with the Census Bureau on their service-based enumeration. If so, I'll move on to the next slide. Okay, so and this is, I guess, for everyone again. Have you or your organizations been promoting the 2020 census to your patrons? And if so, how and what kind of response or feedback have you been getting? So what Pat referred to earlier is hard to count populations. And hard to count populations, or HTCs, are again typically vulnerable or marginalized population. So that includes individuals who are homeless, people of color, particularly Black and Latinx populations, immigrants, ESL speakers, etc. So again, people or households who are more of the peripherals of our society or have less access to, participate. Uh, yada yada yada. But sorry, was someone talking? I'm sorry if I talked over you. Still getting used to the whole,
Yeah,
web
we all
conference.
are. I think you're good.
Okay. But again, so have any of your organizations been promoting 2020 census? And if so, have you heard anything about, people's likelihood of participating or the different barriers, or if they're concerned about participating and what that means about their privacy, things like that? Have you heard anything from, the people you all work with?
And again, while everyone's thinking about that, I know we put up posters and things in our office probably 2 months ago, and we're of course getting James from Salvation Army. They said they have flyers and posters up as well.
Okay.
We're getting ready to really ramp that up when I think the majority of us got either work at home or limited operations.
Right.
Go ahead.
Right.
Talk to my clients and stress the importance of it. I think everybody was pretty excited about doing it, but then again, this happened.
Yeah.
And House of Time is indicating they have flyers up in their office as well.
Okay. Awesome. Okay. Okay.
Addie, one question I was just thinking: are we because it is online? They're pressing it to go online, and of course that would be an issue for our clients to have access unless it's in our service provider offices, which of course now is limited. So how do we address that with our clients? Where do we? What's that next step? What does that look like?
Yeah. And that, again, as a lot of you all are still kind of piecing together how to get things to operate as usual as much as possible. So what we originally planned for was to partner up with Bookmobile, and to have different locations where we had partnered with the library and hard to count census tracts, and we were going to have Wi-Fi hotspots and tablets available and laptops available where people could take it that way. But again, the situation just makes it a little bit more difficult since we are social distancing, and it's how we provide that resource if we can't really be around each other right now, or we're supposed to be avoiding it as much as possible. On the positive note, though, you can take the census other ways this year. You could take it online. If you don't have access to internet services or data services, you can take it by phone. There's a number you can call, and I don't know it off the top of my head. I can send you a flyer to the group or to Pat.
Great.
Get it forward. You can call in this year, and you can call in and you can take it in over around 30 different languages, in English, Spanish, different forms
Okay.
of Chinese, etc. So there are options for calling in.
Hang on, Addie.
Oh, sorry.
We're hitting some background noise of construction or something going on somewhere. If everybody can mute their line unless you're speaking, please. Thank you. Go ahead.
So people can still call in. There's the internet, and then you can also mail in the forms, but that's only if your household or your address received a paper form. So
Right.
really right now, the best ways to do it, if you're not planning on getting counted in a group quarter situation or the service-based enumeration, would be either access to a computer or access to a phone. And again, you can wait until enumerators come out just for the general, reminder phases and knocking on doors. But again, for a homeless house, that might be more difficult. So,
Right.
internet and phone are the best options right now.
Okay. So you'll forward us that number and we can send it out to everyone?
Yeah, no problem.
Right.
Can we move to the next slide?
There we go.
Okay, so in this slide, again, there's just some more links about, if your organization wants resources like digital flyers, since we're not in offices as much, things like that, or videos, materials that you can post on social media, things like that. I have some links over there. I also link the Columbus Planning Department's Facebook page, where we've been posting a lot of 2020 census information. So if you don't have access to that information, or you just don't want to go digging around, please feel free to go on our Facebook page and share through there. And I also posted a video from the Census Bureau about the service-based enumeration and just what different organizations, the different people who are going to be participating in that, what they should expect, how they should, interact with that particular population. Things that I'm sure all of you all already know, but just to get more information about the service-based enumeration, if you haven't participated in yourself, I thought it was informational. So if you want to check it out, it's like 11 minutes, not too bad. But that's available too. So, and I think I have a couple more.
And yes, Lindsay, you said we will email the flyers as well. Yes.
Thanks for. Oh, okay. So my next question, I'm trying to hurry up because I know you all have a lot to do. So I'm sorry for taking so much of your time. I know you all do point in time count, and I was wondering, what these do you all use? Which ones have worked, which ones haven't? And that's just, again, for me, just trying to think of how we may need to have to prepare as a city to be more hands-on than initially expected. So I just want to get an idea about your point in time counts that I know a lot of your organizations do yearly. I'm assuming the operations may be similar, but I could be wrong. So I just want to learn from you all.
Right. And I'll go ahead and start that off. We do yes, we do the yearly point in time count where we do the unsheltered count and we do the sheltered count for individuals and families experiencing homelessness. And again, not to go into too much detail here, but we can talk about it offline. But we literally and physically go into the shelters and on the streets, on the river walks, and all those other sundry places under the bridges and all, and actually do conduct assessments and interviews with individuals and families for the point in time count. So it's a literal count and assessment of each person experiencing homelessness, or those that we find or can track in our community on that given day.
Thanks,
Is that
Beth.
what you were looking for, Addie?
Yeah, no, that's exactly what I was looking for. Again, it sounds essentially like the service-based enumeration, except with service-based enumeration, you have the federal government assisting with that so that they can ensure that the count is accurate for that particular year, which is, the every 10 years. So, no, that does help. And then I think I have one more slide with a question. I think I'll be
Okay. How's that?
okay, perfect. Yeah. And this is really my last question. And if you don't have an answer right now, I completely understand. It's something that's taken me a long time to kind of chew through and figure out and plan out. But what I wanted to know again, just in case that we're tasked as a city to be more hands-on than expected for this service-based enumeration process, in your professional opinions, particularly during the coronavirus pandemic, if you can think about when you do your point in time counts, what resources do you think you would need or your organization would need in order to complete those point in time counts, but with the additional caveat of the coronavirus pandemic? So how would your organization handle that if, let's say, tomorrow you were expected to get a point in time count? What would you need in order to make sure that you and your staff were safe, and to make sure that the public was also safe when you were interacting with them? Okay, so James Roberts, PPE. Do you all have access to PPE normally, or is that something that would be a little bit more difficult to obtain? I mean,
Yes, that's
particularly now.
very difficult for us. Yeah, very much so.
Right. Okay.
In fact, we have, as a community, the order that was placed for service providers has been reassigned to healthcare, and understandably, but as well having to service the clients, everybody needs their protection as well. So.
Right. Have there been? Is there any other types of resources that you would need in order to get people to want to take the census during this time? Are there any resources that you guys can think of that people might be, in order to encourage people to even, come out to take it, if that's their only option is to come to a service provider in order to take it? Duh. I love how we all laugh.
I'll go shake that Dollar Tree there, Josh. Okay.
Yeah. I don't know if you all are aware of this, but I've been working on a zero budget. So as I'm sure a lot of us are familiar with.
We can relate. Yeah.
Yeah. So I can't promise dollars, but I have been talking with people and been discussing possibly making kind of like thank you bags with possibly, food and personal hygienic products, like, that people might be needing right now. And maybe that could be a good way to try and, say thank you for participating. We appreciate it. Take this.
Yep.
And we do that all the time for different events in the city. We give away little goodies and giveaways. So I think the same should apply, if not more, for the 2020 census. So a sticker? No, a sticker.
Matt?
No, that's smart. Sticker.
Who got me?
Okay. Would you all feel more comfortable? Okay, and this is my last question, and I'll be done. If you all had access to technology, would that make doing a count easier for your organizations as far as keeping that distance, this for social distancing, and being able to And I guess in a case of worst case scenario, not being able to have access to PPE and things like that, would that assist?
Maybe you need to explain that. What are your thoughts about what that would look like, Addie?
So, for instance, one of the cities that I actually linked on one of those news articles, San Francisco, one of the things that they've been doing is they've been having tablets and they've been saran wrapping it. Yeah, like iPads. There we go. Yeah. So iPads, tablets. So they've been saran wrapping it or putting it in plastic baggies, and that's how they've been assisting people in taking the census, so that it's something you can take off of the tablet, wipe it down again, replace it, things like that. If you all had access to tablets or iPads and pie in the sky PPE, but other things to try and protect everyone from exposure from the COVID-19 or the coronavirus, would that be helpful as far as if we have to, take a more hands-on approach? Okay.
And I think Tiffany had a question about whether she can assist somebody. I can't see the comments once they go.
Go away.
You see that?
Oh, I think I see here in the chat. Yeah. Okay. So does the client have to complete the census themselves, or could I call the client and ask the questions to complete online for them? Okay, so this actually came up in a recent training. So Connie Madrano, one of our partnership strategists, she said basically if you are a person who would normally do that level of assistance for an individual, then it would be appropriate. So, like for example, if my mother needed assistance taking it online, because I help her with other forms of digital forms online and she has that trust with me, I could assist her with doing it. If that's not your typical role with that person, I would advise not to, and the Census Bureau would probably also advise you not to, just because, again, it is still a confidential process, or it's supposed to be a confidential process, and since we're not sworn in by law, like Census Bureau workers are, we don't have the same amount of accountability as they do when they assist someone taking the census. So I'm not going to say whether or not you should. I just really think it depends on your relationship with a particular client or person. So hopefully that answered the question.
Any other questions? Yep.
Okay, well, if not, if you have other questions, I had like a really quick Google form survey. I think it's like 5 or 6 questions. If you want to do it, fine. I think that'll be really helpful. If not, don't worry about it. And then that last slide that I have up there, I just want to thank you all for doing the great work that you all do. I know that this is a tough time for everyone, but you are also people who are on the front lines, so I appreciate all the work that you do for, protecting and making sure that our most vulnerable populations have access to the services that they need. So thank you, everyone, for all that you do, and thank you for letting me, share this information with you.
Thank you, Addie.
No problem.
All right. Now let's go on to some other topics for today. The statistics for Muskogee and Russell County. As of this morning, we had 47 confirmed cases in Muskogee County and 10 in Russell. And as was stated this morning on the daily community call that a lot of us participate in, we're expecting probably starting tomorrow, but certainly by the end of the week, the Muskogee numbers are going to increase. If for no other reason other than that there were hundreds of tests done between last Friday and yesterday at Cascade Hills by Mercy Med in conjunction with Department of Public Health. So those numbers are going to go up probably a good bit in the next couple of days, simply because there was access to a lot more testing than we had in the past. But those are the numbers as of today. And just want to talk about some of the things that have been going on that I and the folks at Home for Good are aware of. And please, this is the time where we can have those mics open and have this open discussion about what's going on. Some of the things we've done in conjunction with other partners and most of you all sending out and posting flyers in places that are frequented by our clients, hangout spots. We all talk about or know about the water park and 23rd Street Pavilion, those kinds of areas. Just information flyers about covering your cough, what are the signs, where to get services, where meals are available, and all kinds of things. Prior to last Friday's shelter in place order by the governor, we had gotten the city to open back up, the 23rd Street Pavilion restrooms and stock them, and we had a sanitation and cleaning schedule ready to go. It is locked as of 6 o'clock on Friday because of the governor's shelter in place. We had hoped to have clarification about whether we could open that again or not, because we do still have unsheltered homeless, even though we have a new temporary emergency shelter. But we didn't get clarification on Friday before the shelter in place would take place. We did not get clarification yesterday after asking it again. And then this morning on the call with the governor, it's still not clear. So we've done that as they've asked, and we've resent it to some committee chairs for them to get with legal for those clarifications. So long story short, sanitation and hand washing station at 23rd Street Pavilion is closed at this time, simply because we want to comply with the governor's shelter in place order as a city, as a community, and as service providers. I alluded to a few minutes ago the temporary emergency shelter that opened up after March 18th. March 18th, Valley Rescue Mission, as most or all of you know, on March 18th closed their men's shelter, and that left 35 men who had spent the night there the night before with no shelter for that night and henceforth. Neil at Safe House opened up a temporary shelter. Thought he was going to only have to do it for a few days, and well, lo and behold, Neil's been in the emergency shelter business for a while, and also has an isolation capabilities for those who need to shelter in place who are experiencing homelessness. So, Neil, I don't know if you wanted to say anything about the shelter at this point, or I can't see if you're muted or not. So if you want to speak, Neil.
Hi, everybody. So after the curveball, we had to do something, and so the Safe House, fortunately, has several different areas, all on separate HVAC systems. So we made the decision to use kind of the normal Safe House part of the church campus as an emergency shelter. Just so everybody's aware, we're open from 6P until technically 6A as a shelter. But since the Safe House opens early in the morning, we're just not closing and reopening. We are closing from 2:30 to 6 every day so that we can deep clean the facility in preparation for everybody moving in that night. So far, 329 bed nights, 72 unique individuals, women and children. We've had a lot of folks. If we take the approach that this is a community health issue, and it's also a chance to provide a health resource for our clientele, the Safe House is using thermal forehead thermometers for every person that walks in the door so that we can keep tabs. Anybody that's 99 or higher, we are putting on a watch list and then checking them hourly to see if anything changes. Praise God, nobody has had a cough and a fever. And so the isolation area of the church campus is going to have to open. Just so that you're aware, we do have the opposite end of the church set up as an isolation unit. We created it at the emergency management meeting back on March the 20th. And yesterday, DPH was here to do a tour just to make sure that we had dotted all the I's and crossed the T's. Mercy Med will provide Dr. Scarborough twice a week and a nurse every day in the mornings to pull vitals. And I'll pull vitals at night. And we've been given instructions as to what levels cause us to make which phone calls. So the Columbus Baptist Association donated a shower trailer, and the city is allowing us to block the sidewalk off so we have an outdoor area to get sun. We have a showering area that's removed from the rest of the world. And I'm praying we never have to open and we can take some nice pictures of an empty area. That's what's up, Pat.
Okay, any questions for Neil at this point before we keep moving? All right, we'll keep on rolling then. There's been some outreach going on, and outreach, of course, today looks a little bit different than it did, 2 weeks ago or a month ago. When we think about that how much has transpired in just a short time that we've been, I think today is day 25 of the national emergency. So let's, if we want to talk with outreach, I know Virginia from PATH is on. I know Terry is on. Terry, if you want to get started and talk about some of the things that you guys have been working on as far as outreach and what that's looked like and how that's different.
Oh, sure. Typically, we were going out 2-3 times a week and making the rounds, checking on people. When this first started, we sent out requests to agencies and churches for their outreach schedule so that we were making sure that everybody was covered and that we weren't duplicating services.
Mhm.
It became, it's more important now that we don't duplicate services than it was before. And thanks to Neil and the people at the Safe House, we've been able to ensure that the 211 intakes are being done for the people that, where we had been going out in the field and doing those. A lot of them are being done at Safe House. Thank you, thank you, thank you. Safe House people. We've also heard from Melinda at VIP and Chuck Odom at the Verge Church. And Chuck and I have gone out a couple times, and Melinda joined us last week and will from now on join us. Outreach is a little different. We maintain social distancing. Primarily what we do is we educate the people on COVID, recognizing the symptoms, where they can go for treatment or assessment, and shelter information, food information, where they can get food. We also remind them about the shelter in place thing and remind people that if they're out on the streets, they're going to get arrested. We have people that are hiding in the woods, and Chuck is really good about going up in there and giving them the food that they need. Melinda and I went around and gave out food and put up flyers Thursday. We'll go out again this week. And right about an hour and a half before this, we got a schedule from PATH too, so I'm hoping to be able to partner with them. And because with social distancing, I know when I went to the water park, everybody came up to me. Maybe if there are more of us, it won't be, people won't be rushing up towards us, and we can still protect ourselves as well as the clients.
Thank you, Terry. Virginia, did you have anything you wanted to insert at this point?
We're pretty much going out. Hey everybody, we're pretty much going out. We are practicing social distancing. For one, I am a part of the high risk population, so I definitely have to practice it.
Mm-hmm.
But it's more pastors more so turned into educational outreach. The calendar that was well, I sent the calendar to my upper management to send over to you all. So we're not going in the typical places where we know everybody would go. We've been going out looking for individuals where we know they're not going to usually be, which is you look at the calendar, you will see that there's people posted up off of 13th Street and 13th Avenue. There are individuals that are under the River Road Bridge off of River Road. We even seen an encampment that is in the woods going off of the expressway of Airport Thruway, but can't figure out how to really get in contact with that person. Every time we go by there,
Sure.
there's nobody out.
Sure.
Unfortunately,
Sure.
we're not able to go in the woods without police escort.
Mm-hmm.
So we're going to leave that up to Terry now. And I know when this first kicked off, the Homeless Resource Network wanted us to see if we can find a lady by the name of April. And we've been looking for her in the big city area, but we haven't been able to find her.
I know where she is.
So is anybody...
Okay. All right. Remember that we have people on the call that don't have confidentiality. So let's stick to first names only, please, and maybe we can discuss that offline.
I'll send you,
Okay, well,
send you
Terry,
the information.
if you know where she is, can you send it to the Homeless Resource Network?
Absolutely.
Cool.
Okay. And that's pretty much the gist of it.
Okay. Well, thank you there. Thank you. And I know we're getting close to 15 minutes out, so trying to speed along here, but do want, if anyone from Salvation Army is on the call, just to give a brief on what you guys are doing or doing differently, you're welcome to do so now. I saw Josh earlier.
Yeah, I am on the call. Can you hear me?
There you are. Hey, Josh.
Hello, everybody. As far as our community meal in the evening, that is still going on. We have seen an increase in the number that are coming to dinner. Those are all to go, so nobody's actually eating on site. Those meals are prepared in clamshells for people to take as are needed, as well as making our food pantry is open during its normal hours and doing those things. So we've seen an increase in the number of people coming to get food. So those things are operating as normal. For the most part, as far as our social services offices open like normal, and trying to do the best to, as much as can be done over the phone as far as interviewing clients and
Sure.
some of the things that are going on. But as far as our staff being there and working and still providing services, that's still going on.
Okay. Well, thanks, Josh. Neil, I'm going to skip over you in Safe House because, as you said already, you're providing your breakfast and your lunch, and then I'm providing dinner for those in the shelter. So we're going to skip on. I'm not sure if Katie from St. Anne is on the line. Katie? Well, I went ahead and wrote down some notes about St. Anne Outreach. They are still doing their food distribution on Tuesdays and Thursdays. It's by appointment only, and the phone number is 561-8678. They're doing that distribution from 9 to 11, and I think the 21st their rental assistance line will open up again. We'll attach those numbers and contact information to the slide presentation when we email it and post it on our website. Valley Rescue Mission is also doing a grab-and-go meal at 3:30 every day. Kim or Valerie or another representative from Open Door, are you on the call to talk about what's going on with the showering program really quickly? I know Kim had an earlier appointment and she may have been running late. Okay, so as last we heard, showering program is still operating as normal with only, obviously, the having only 10 people, that to include staff, in the program at one time, and making sure that all the CDC guidelines and the mayor, the governor's guidelines for social distancing are met. Liz or anyone from Homeless Resource Network want to comment on anything you're doing differently, new, or any information you need someone to know? Okay. I'm trying to change to the next slide here real quick. Okay, that being said, going to go quickly through this COVID-19 intake. This, first of all, major kudos to the HMIS committee of the COC. Last 2 weeks ago, they voted on putting the screening tool for COVID-19 into our HMIS system. It was a tool that was designed in Atlanta by their COC. We took it and tweaked it just a bit to personalize it, put it in our HMIS for everyone to be able to use, and please use it. And then found out last Friday that based on that intake, based on that screening assessment that we were using and that we put into our system, Ecovia, which is the parent company of ClientTrack, our software for HMIS, they took that tool, again, tweaked it a little bit, I think really improved it, but tweaked it, and are using it as a baseline in all of their software that they've rolled out across the country. So this afternoon, in just a little under an hour, there will be a sync going out on our system in which this assessment will be available for everyone. And of course, it will meet all of the guidelines necessary. I'm going to, again, quickly go through this because we've gone a little bit longer than I had anticipated at this point. And if I can operate the slides a little bit quicker, that would be great. Okay, so just quickly, and this is in training, nobody's information, but if you were in a client and you needed to do an assessment, you go the same way we would do as normally. Go to your little dots over here, hit show the menu. It's going to pop up right over here as a COVID-19 intake. Now, I'm going to do this one as an existing client. You just confirm, yep, that's me. I am Mr. Test. It's going to give you a couple of, a little bit of information here. Oh, sorry. Apparently now my clicker's working. Let's try this again. Mr. Test, there we go. Talks to you about what to do in case any of they're having the severe symptoms. Talks about a little bit about other allergies and those kinds of things. Brings over the information for Mr. Test. And you see here that we're able to put your screening date will auto-populate to the day you're doing it. The current temperature, Fahrenheit or Celsius, can be selected. Then this really cool thing, if you check these three, you're immediately going to get this right here, this pop-up that says client should be masked and isolated. If you, come on now, oh, now it went one too many. Let's try to go back. If you don't select all three, then you see you don't get that pop-up. So you'll also be able to click any existing health conditions that the client might have. If there's been known exposure, again, that's by asking the client, do you know if you've been exposed to anybody who has been tested positive? Have you been tested? Do they have pending test results and all? It would be pending, positive, negative. And again, this little alert button or alert box at the bottom here with a little exclamation point. Again, if the client had to be masked and isolated, then you would send them to Neil at Safe House for isolation and care from a medical professional. simple if you were looking and you needed to add a new client, and majority of adding the new client simply in this way would probably be those who were coming into Safe House for shelter, who had not accessed the system again, but it could be anybody. Anyone who is entering the system who is not already a client. Simply add them by doing the search like we normally do. This PAFR or Pat Frey pops up, but no, I am Pamela Franklin. And you put my data in, of course, the red asterisk, you need to at least ask. If the client refuses or doesn't know, then note that. Fill out just this general universal data elements, and then finish up the basic screening. The date fills in again the day that you did it, and then it immediately takes you to the COVID-19 screening. And you are, once you've done that, and you're done. I mean, you hit save and it's done. Now, quickly, one of the things is, where would this screening be saved? Or how do I access it to know that Pamela Franklin did have that COVID screening? On the client's dashboard, under other assessments, trying to get my little pointer over there, and it doesn't want to go. Other assessments, you can see that it says COVID screening, and then you simply click COVID screening, and then it shows up that Pamela Franklin did have a COVID screening. Very, very simple. Again, the sync will happen this afternoon at 4:30. Zip through that a little bit faster than I wanted to, but wanted to make sure we have time for a little bit of discussion at the end. So we got about 8 minutes to go. Are there any questions right now? Probably more questions once you get in there and start playing with it. Don't hesitate to ask questions, or to let's share ideas, or how can we do this better, or those kinds of things. We will have a way, if it should be necessary, for public health emergencies or public health needs, if we're trying to track someone who needs to get isolated or whatever, we would have the resources to do that now with this new tool. Any questions so far?
Pat, you said that it was important to put their phone number in there.
You're right. You're exactly right. Thank you, Terry, for pointing that out. If you are in a client's record and there's a way, and the client has a phone or has an email address, or you know that they get their messages somewhere, please put a contact information, especially when we have public health maybe trying to locate someone to be able to assist them with getting care or something. So just thank you for reminding me of that, Terry. I saw something pop up in the bubble, but again, because I'm on these slides, I can't see the comment. So did somebody have something?
Tiffany asked if we only need to do the COVID screenings on current clients if they're showing symptoms, or should we do it on everybody?
That's probably going to vary from agency to agency. It would not be a bad idea to do it. However, again, depends on your agency, your capabilities. Do you have a thermometer? Do you not have a thermometer? So that would probably vary from agency to agency. So what's our next step? What do we need to do? How do we better collaborate, coordinate? And then what can we do to help each other? Let's everybody unmute your phones or whatever, and let's have a discussion, if you will, on what do we need? What do you need? What do any of us need? How do we go forward over the next 2, 3, 4, several weeks in this endeavor and come out better on the other side and stronger? Now this group is not quiet.
Do anybody have any supplies of PPE or know of a way to get them?
Actually, but right before this call, I sent an email to emergency management, because we had placed an order on actually the 20th of March, and that order, as I said, was circumvented to healthcare. Another order went last week. So to answer your question today, no. The email I got back was hopefully next week. That's what I got. But if somebody hears or knows of anything, we will definitely put the word out, hey, who has some and who has access. But as of right now, I don't know anybody who has any more or has any extra, that's for sure. Anyone else?
I have a question.
Go ahead.
Homeless Resource Network, when will they be accepting more clients again?
Okay, we'll have to get back with you, or possibly Liz or somebody can get back with you on that.
Okay, thank you.
Okay, oh, I'm sorry. I finally realized how to work slides. We're almost done. Announcements and upcoming events. And announcements is missing an N. I just noticed that. Great. We will, at this time, we are planning to do another virtual housing navigation COVID response meeting on May the 5th, which is, of course, the first Tuesday in May. And we'll send out the link to that meeting almost immediately after we finish up this call. Again, we'll be posting these slides and all the resources in these slides and the links on our website and in our Facebook page. We'll also attach them to the weekly announcements that go out on Friday. And any additional, we're going to get some minutes. We're going to get some minutes typed up. I'm not going to promise that they'll be done in the next couple of days, but we'll do a transcript for in case you want to share the minutes with anybody of what happened today. There's some posters attached to this presentation as well. Wash your hands kind of thing, and here we go. Cover your cough. Just a reminder, these are one of the posters that outreach went and put out in the areas that were frequented by our homeless folks, just giving some reminders, also talking about resources and who has meals and those kinds of things. And talking about Georgia Legal Services set this out yesterday about those who are in rental housing and talking about what laws apply to them and how to reach them. Also, some information from Addie on the census and that adjustments to the calendar. Some resources, whether they be HUD, infectious disease toolkits, CDC guidelines, and all kinds of other stuff from CDC and HUD on how we are dealing with this, how we're going to deal with it, and as they change, of course, we will send them out and include them in our weekly announcements. All of the links for Addie's presentation and all the links that were in her slides. And that is all I have. Anybody have anything else they want to talk about, go over, needs to make others aware of at this time before we wrap up? And I got it in under the wire with 1 minute to spare.
Pat, before the people hang up, if I can't see your name on the list of the participants, can you at least let me know who you are so you get credit for it with the COC for attending the meeting?
There's just the people on the phone are the ones. I know we had Edith and a couple others on the phone. I know Tammy was on the phone.
I think Melinda is caller 5. I think.
Okay. Anybody? Who else is on the phone, please, just so we can have an attendance.
Hey, this is Anthony.
I'm sorry. Say again.
Antonice is.
Melvin is on the phone.
Okay.
All right.
Okay.
Antonice.
Cheryl is on the phone.
Who is that?
Cheryl.
Cheryl.
Hey, Cheryl.
Hey, Pat.
Pat,
Awesome.
I'm on the phone. This is Virginia.
Hey, got Virginia.
Awesome.
My phone.
We got Virginia and Vivian, Gary from the VA, Terry and Tammy and Tiffany, Shantae, Reverend Mike, Pam, Neil, Melvin, Melinda, Liz, Kawana, Josh, John Castillo, Isaac from DCA. Welcome, Isaac. Devlon, Kathy. Anybody's name we did not call.
Did you get
Perfect.
Anthony?
I got you, Antoinese.
Thank you.
All right. Anybody have anything they need to discuss with the crowd, put out there, or whatever before we call it a day? We'll give it about 30 seconds before we end the call. And I will go ahead and save the chat as well, in case somebody needs to look back on the discussion that took in the chat. I'm going to go ahead and copy that now. Come on, cooperate. I'm going to copy that now just in case we need that for the future, in case someone saw something or read something and needs to get it again. All right, having nothing said, we're going to call this meeting to a close. Thank you all for joining us. Have a wonderful afternoon. Stay safe, and don't forget to communicate with each other and what your needs are, and go out and be good to yourself. Thanks. Bye.
Bye.
You put batteries in your mouse?